Today, we are discussing mitigating the public health effects of climate change with Sten Vermund, who is the Dean of the Yale School of Public Health, the Anna M.R. Lauder Professor of Public Health, and Professor of Pediatrics at the Yale School of Medicine. He's a pediatrician and infectious disease epidemiologist with an appointment in the Department of Epidemiology and Microbial Diseases. His research focuses on diseases of low and middle income countries and on health disparities in the United States. His research has also focused on healthcare access, adolescent reproductive health, prevention of HIV transmission, both mother to child and among adolescents and adults. As with so many other public health faculty, his most recent work has focused on the COVID-19 pandemic. Dean Vermund has founded two non-governmental organizations in Zambia and the other in Mozambique and Nigeria. He has served as a principal investigator of the HIV Prevention Trials Network from 2006 to 2012 and is a member of the National Academy of Medicine. Welcome, Dean Vermund. Thank you so much for joining us and presenting as part of our climate change conversation series.
Thank you, Lauren. It's a great pleasure. I'm going to just ask if you could see my slides and if you can hear me.
Yes, on both questions.
Brilliant. So a great pleasure to join the alumni today and see a nice audience. So tackling these public health effects of climate change is today's theme, and let's just dive in. Oops. So at the risk of telling everybody something they already know, the past 7 years are the warmest in recorded history, those years from 2014 to 2020. The top 2 years in terms of heat on the planet were last year and 2016, both of which had a temperature a little more than 1 degree above the 1951 to 1980 baseline. That's 1 degree Celsius. And the results, consequences have been a massive loss of sea ice and ice sheet mass, sea level rise, and longer and intense heat waves with major habitat changes for the flora and fauna of our Earth. The CO2 trends are unremittingly upwards. There has been no asymptote or decline in these trends despite efforts to reduce greenhouse gas emissions. When one looks at certain easy to measure signs of global climate change, one can look at the summer Arctic polar ice cap. It's been shrinking 9% per decade, and in the past 10 years, the loss of ice has equaled that of the previous 10,000 years. If you look, it's hard to read, but if you look here at the nadir in the summer nadir of ice sea, this is in the neighborhood of 3 million square kilometers, and this is in the neighborhood of 7 million. So the 7 million was the 1981 to 2010 median. So this is a nearly 60% loss. By the way, I should mention, if you're going to jot down references or the like, this is recorded. You can see it at your leisure, but I can also send you the slides. Anyone who would like the slides, they're 15 megs, and that may not get into everybody's emails. So I'll save it as a PDF, and if you need it as the actual slides, just let me know. So here's a little video.
We can post the slides on our website.
Oh, brilliant!
So we'll
That's
post
even.
The slides for everyone
thank
on the
you
website.
so much. That's brilliant. Thanks. So let me show you a little video. This is the other end of the Earth, the Antarctic, and let's just run it. So this is the mass loss in gigatons, and showing you with some sort of color in terms of meters water equivalent relative to 2002, where the loss is occurring on the Antarctic continent. And you can see that certain venues are having very, very intensive ice loss in this 2002 to 2016 time period. Now, part of the result is glacial calving, calving as a cow would release a calf. This is where one has more water and less ice, and this will result in expanding crevasses and expanding ice rivers within the ice. And you can accelerate the calving. Calving is a normal phenomenon of glaciers, but you can accelerate this when you have greater water flow. And there has been recorded calving of an ice flow the size of Rhode Island. This doesn't immediately change water, increase water volumes because it's neutral on volume, but it will melt, and that will eventually increase water tables worldwide. And it melts more quickly than if it's calved sort of normally, because there's much bigger calving going on at the present time. Perhaps the scariest slide is this one, the thermohaline circulation, particularly the Atlantic meridional overturning circulation, the so-called AMOC. And this is from a paper just published last month. This suggests that internal variability from the Atlantic Ocean may have dampened the magnitude of global warming over the historical era, taking into account this AMOC weakening, which means a certain slowing of the circulation. So what is the AMOC? This is when the cold water circulates in deep currents through the Atlantic Ocean and other oceans into the tropical regions. It surfaces as it's being warmed and transforms into sort of a river within the ocean, which are these streams, and the Gulf Stream, most famous of them, which is why Norway, and Iceland and the Faroe Islands, which are well within the same latitude as northern Siberia and northern Canada, are so much more benign climates because they're being warmed by these Gulf Streams. And the slowing of these currents all by itself will contribute to global warming. And it's also uncertain the extent of damage we're going to see to ocean biodiversity. We already see fish populations that have migrated into cooler waters because that's what they're adapted for. So we're really uncertain what kind of damage this is going to do to Mother Earth through something that we've never seen in our history. If you go to the freshwater environments, I could use 100 different examples, but I'll just use this one, which is Mount Kilimanjaro, Africa's highest peak. Ernest Hemingway, with his short stories, The Snows of Kilimanjaro, and the movie with Gregory Peck, Susan Hayward, and Ava Gardner. These are from the 50 years ago. But if you look back 110 years, you'll see the snows on Kilimanjaro very substantially shrunk by 1970. But just in the 30 years to 2000, the 7 years to 2007, if you go up to do it sort of with cartoons, you'll see the dramatic differences, and satellite photos, you'll see the dramatic differences. So we have deforestation in this region, we have global warming, both of them are synergistic, contributing to the virtual elimination of the ice pack on the top of Mount Kilimanjaro. Something similar is happening to glaciers all around the world, including in our own country, Glacier National Park and the like. Now, evidence for global climate change as a consequence of man-made greenhouse gas emissions is irrefutable and overwhelming. It's as strong an association as HIV causing AIDS, as HPV, human papillomavirus causing cervical cancer, as the SARS-CoV-2 virus causing COVID-19, or to take some chronic disease examples, asbestosis causing mesothelioma, or smoking causing lung cancer. Scientists who disagree are typically on the payrolls of the interested parties, including the fossil fuel industry and their media and political advocates. And if you ever see a debate on climate change between a scientist and somebody else, that somebody else is typically not a scientist, but rather an expert debater brought to television as a paid lobbyist without any scientific background at all, but they are prepared with the tropes claiming that climate change is a hoax or is not of human origin. So let's tackle the topic today, the health issues. I'm going to talk about direct effects of heat first. Global climate change was known as global warming originally, but a political lobbyist wanted to soft pedal to global warming and renamed it as global climate change. Actually, we prefer the term global climate change now because there are some parts of the world that actually will cool as the rest of the world warms. And there are many elements that are consequent of climate change that may not be warming per se. So global climate change is a perfectly good term. Some of these direct human effects are just as a consequence of hotter and drier summers and the heat-related deaths that may particularly affect the elderly. We've seen heat-related deaths in multiple continents, including Europe and North America, where the elderly whose air conditioners were not working or who did not have good air conditioning could not get it repaired in time and actually died of heat stroke. Warmer and wetter weathers as a consequence of polar and glacial ice has potential health consequences that are direct, and increased extreme weather, so-called adverse events, that can obviously affect human health. A loss of property and the use of property, crop loss, can have human health effects. And we haven't even seen the ultimate consequences of the loss of reef ecosystems, fish populations that are nurtured by these reef ecosystems, and the loss of ocean biodiversity in general. This is a nice model that CDC's Climate Change and Health Program has produced. You can just type CDC Climate Change and Health Program or impact of climate change on human health and get this as a picture file and use it for your own teaching if you'd like, make a poster out of it, whatever you want. But you can see, we don't have time to talk about each and every one of these, but you can see how extreme heat, severe weather, air pollution, changes in vector ecology that we'll talk about in a minute, increased allergens, water quality impact, food and water supply impacts, and environmental degradation are feeding all of these many human health consequences. Let's look at climatologic displacement, the notion that we have climate refugees who would ordinarily live in their own homes, but must migrate as a consequence of degradation of the environment due to either climate change directly or due to extreme weather events. There are 39 countries and 5 territorial regions, including some of the US territories, that are especially vulnerable to climatologic events. They have banded together in the Alliance of Small Island States. And I've been lecturing on this for many years and have talked about the Alliance of Small Island States. So I wasn't surprised to see how prominent they were in the recent high-level event on global climate action in Glasgow that just finished 2 days ago. And it's because some of these venues, their most populated areas are very low-lying, as in this picture. I think this is from Jamaica. And there are many other examples where even entire nations are threatened. This was the Tuvalu Minister for Justice, Communication, and Foreign Affairs, Simon Kofe, giving a COP26 statement just last week. And he gave it from his home country. And that's how it looked when he started his talk. And then they expanded the scene, and that's where he was giving his talk from, to dramatize how vulnerable his own island nation is to climate change and to actually threatening the entire integrity of his nation. There are already many persons in Tuvalu have had to be relocated because their environments are no longer habitable with rising ocean sea levels. Keep in mind that a very small rise in ocean sea level can change the dynamics of storm surges, tides, and the like. We have tremendous challenges in tidal dynamics in cities as diverse as Miami, Florida, and Portland, Maine, which are now experiencing routine flooding, which was only rare in past years. Modeling done a number of years ago from the shuttle radar topographic mission and other modeling has suggested the vulnerability of places like Florida, where the entire Florida Everglades would be inundated with salt water with a 1 meter rise of global waters. And this would be obviously absolutely devastating to the ecology of this huge natural park in Florida. But some of the most attractive and costly regions in the entire state would be afflicted. This is one model, and this is another model, and this would include the flooding, the entire flooding of the Kennedy Space Center. So how does global warming affect storm formation and intensity, hurricanes, cyclones, tornadoes? And as most of you know, as temperatures rise, more and more water vapor evaporates into the atmosphere, and this is fuel for storms, as the meteorologists explain it to us. And more heat and water in the atmosphere combined with warmer ocean surface temperatures increases the wind speeds of tropical storms. There are analogous phenomena with temperature inversions on land, which can help drive tornadoes. Now, keep in mind too, and we'll talk about this a little later, snow reflects heat because it's white, while rock absorbs it because it's dark, and freshwater snowpack melts and glacial losses create a sort of cyclical effect that the more loss of snowpack you have, the warmer it gets, and the faster subsequent snow will melt. So we have new cycles of floods and then droughts because you have earlier and more substantial snowmelt, faster snowmelt, and then you don't have that feeding of the river valleys, and you end up with droughts later in the year. But we'll talk about that a little more in a minute. There are also vast costs of these severe weather events. Hurricanes Katrina, Harvey, Irma, Maria, Dorian are just a few of them. Not accounting for inflation, 15 Atlantic hurricanes have resulted in more than $10 billion of damage each, with the peaks being Katrina and Harvey with $125 billion damage. And folks, we ain't seen nothing yet. Vectorborne diseases are going to become more common because the vectors like moisture and warmer weather and global climate change does result in most venues with both warmer and moisture, sometimes warmer, drier, depending, but warmer in any case. And if you want to help a mosquito or a tick live longer, you'll make it a little warmer for them for a longer season of high temperature, and you'll make it a little more humid for them. So there are many mosquito-related infections. You're all familiar with malaria, and you're familiar with arboviruses. Arbos comes from arthropod-borne viruses, so arboviruses. And these include dengue fever, yellow fever, Zika virus, West Nile, Eastern equine encephalitis, even viruses that are endemic to the state of Connecticut. There are other vector-related infections, and they can be transmitted by black flies, snails, rodents, tsetse flies, the so-called kissing bug of Latin America, the Reduviid bug, ticks, causing the diseases here on the slide. And by the way, we have experts in most of these diseases at the Yale School of Public Health, and we're among the, I think we are among the only places in North America that has two major labs working on trypanosomiasis. I can't help bragging about them both. Chris Chudy, who's director of our graduate program, and Sarap Aksoy. And Sarap has just been elected to the National Academy of Sciences, which is really quite an extraordinary honor. Anyway, we've been working on these diseases for years, and our jobs become even more acute and even more urgent in the climate change era. And there are waterborne diseases as well that can be facilitated by having water be warmer and more frequent. Here's an Anopheles, a mosquito that will transmit malaria and some arboviruses. Here's a culisine. This one happens to be Aedes aegypti with its sort of salt and pepper format. And here's a tick, obviously. Now, if you go to malaria in the highlands of Zimbabwe, this is what it looked like in 2000 with a heat map. And if it's bluish, there isn't much malaria. And if it's bright red, there's a lot of malaria. And take a look at the projections in 2050, what it's going to look like. You're not going to have hardly any malaria-free zones or low malaria zones, and nearly the entire country will be an intense malaria transmission environment. And what's good for malaria is good for all the arboviruses as well. So take a look at population pressures. We have shrinking land and water assets because we now have 7.8 billion people. By 2050, we'll have 9 billion people on Earth. Would any of you care to guess what the population of the planet was when I was born in the early 50s? 2.3 billion people. So in my lifetime, 2.3 billion to 7.8 billion. And it took us millennia to get to 2.3 billion. So let's talk about that. There are 222 million women in low and middle income countries who want family planning but don't have access to it. This results in 63 million unintended pregnancies, 19 million unsafe abortions, and many of these folks are very young, 14 million under 20, 50 million under 25. There are 82,000 maternal deaths among women who, if they had contraception available, they would have used it because they did not want any more children. So the key elements are obviously education, especially for girls and women, confronting the unmet need for birth spacing, because women would like to space their children. They don't want a child every 10 months, and they want access to contraception and family planning with concomitant improved maternal and child health and survival. And we think that managing size of families will help with sustainable economic empowerment for both women and families. I personally always mention population pressures when I talk about global climate change, because I think they are related. And if any of you would like to debate that, feel free to bring it up in the Q&A. Here's an example of population growth pressures around Lake Victoria. Lake Victoria is a vast lake, as you know, with Uganda, Kenya, and Tanzania. This is in French, bordering the lake. In 1960, this was the density of population. Fewer than 25 inhabitants per square kilometer was the majority of the area, with only a smattering of greater than 100 inhabitants per square kilometer. But you look at 1980, 1990, 2000, 2005, 2015, and now it's the other way around. The majority of the areas are with more than 100 inhabitants per square kilometer. So we have overfishing of the lake, overgrazing of the land, farmland pressures with higher population density, and we're already seeing hunger and climate refugees related to changing freshwater dynamics combined with overpopulation in many parts of the world. So you do not get the fish that you used to get from Lake Victoria, neither in quantity nor in size of fish. Now, here's an example from Uzbekistan, just to show you how diverse the venues are. If you look at the dark blue here, that's where the Aral Sea is now. But if you look at the entire map, that's where it used to be. So here's sort of an imprint of what the Aral Lake used to, Aral Sea used to be, and what it is now. Here's a gentleman standing where the sea used to lap onto. So this is a vast water volume that has vanished. And this is the graveyard of many, many fishing vessels, because there are no more fish to harvest because of diversion of rivers that used to feed the Aral Sea for cotton growing and other crops, extreme irresponsible pesticide and fertilizer utilization, and the salinization of the Aral Sea such that it's no longer available for consumable freshwater fish. I should mention Lake Mono in Northern California has been drained to feed the city of Los Angeles. Lake Chad, which I visited just recently in the month of August, because we have a project in Chad, also a fraction of its former size. Now, if you go to the Sahel, where Lake Chad is located, Sahel means shore in Arabic, it lies between the desert and the fertile grassland of rainforest to the south. There's a long dry season and a wet season. However, diminution of the wet season has brought chronic drought to this region, famine, misery, and hardship. And the Sahara is taking over large swaths of the Sahel, so-called desertification. So it's under stress from overuse of the land, farming and grazing, and global warming and climate variability. And of course, people have to migrate when they can't live off their land. So climate change, agricultural processes, political processes, population pressures, all are transforming lands that might have looked like this to lands that look like that. We also have deforestation, which is another element, not vastly dissimilar conceptually from desertification, and the chopping down of rainforests, the burning of the brush, preparation for farming or grazing, and then because the rainforest land is different from other parts, often the exhausting of that land in just a few years, such that one repeats it all over again. And one looks at the thousands of fires burning in the Amazon on any given night as mapped by satellites, it is absolutely mind-boggling. You're all familiar with the Australian and Western USA wildfires, with smoke exposure and poor air quality, mental health impacts, people losing their homes, and the temperature records that we've set in the last 2 years, the hottest day ever records broken all over the world, from Siberia to Arizona this summer, 2021 summer, and I've already mentioned the 2 hottest years in history. COVID-19 had a strange result. Impacts on carbon dioxide emissions were favorable, because there were these big lockdowns. But food supply chain impacts were extremely complex, and by no means was it all somehow rosy. Finally, evolving drought and flood cycles with famine risk. I promised to talk a little bit more about that when I introduced it earlier. So this is a picture of the endorheic basins of the world. I had to look this up. It's a drainage basin that normally retains water and allows no outflow to other external bodies of water, but the drainage converges instead into lakes or swamps that equilibrate through evaporation. And just take a look at the vastness of the Himalaya, but also in Europe, also in the Andes, also in the Rockies. There is tremendous importance of frozen water. These are some of the glacial changes in the Himalaya. The bigger the dot and the redder the dot, the more loss of glaciarized area there is. Now, let me just point out that you've got the Tarim River, but this is not very populated. But the Indus River serves all of Pakistan, one of the most populous countries in the world. The Ganges serves what will become the most populous country in the world, namely India and Bangladesh and the Brahmaputra, and then the Mekong River Delta. So the Himalaya are serving these major river basins. And what's happening is snowmelt onset and end dates are occurring early in the year in the context of overall glacial shrinkage and warming of the earth. The snowmelt period, essentially how long snow takes to melt off, is shrinking. So there's about a 3-week shift in snowmelt onset and end dates, moving it earlier. And trends show less snow melting earlier and faster. And the future is that we're going to be running out of water earlier in the year. All of the farmers downstream in these vast river basins, representing 1.5 billion people on Earth who are going to be affected, are going to have intermittent droughts, and they'll have early season floods because they're going to have much more rain melting, and also you're going to have rain falling on snow, which is going to accelerate melting. So rainfall may be increasing. It's not necessarily a net decline in humidity, but the overall water is less critical than the timing of the changes. So reduced water consistency for planting, harvesting, drinking, and hydropower. And the work of Smith and Buchhagen is sorting all of this. By the way, if you really want to read more about this book chapter is very accessible to somebody like me who's not a meteorologist. So what are we going to do about this? Research, policy, education, action. This is both feasible and necessary. And I think it needs to be primarily focused on global climate change, but we've got to be attending the loss of global biodiversity at the same time. And I personally think we also have to be attending to unmet need for birth spacing, where the women of the world are asking for access to contraception and they do not have it, to 222 million estimated by the UN. So here are a number of points. Efficient transportation. One can have solar-powered electric cars. Not necessarily having the solar panels on the car itself. Maybe we'll get to that someday. But one can charge the cars with solar panels. This is now what my wife and I do. We have a gone solar panel in our house, and we charge our electric car with our solar panels. Now, that's not going to reduce global climate change much, but I'm hoping we can be an example for our neighbors. Buses, trains, all of them can be on sustainable energy. Now, my cousin in Norway, who did transportation policy his whole career, tells me, Sten, you missed the point. You've got to get out of your car. You've got to get into public transportation. It's not good enough just to have a more efficient car. And so I've been making efforts to do public transportation much more, go to the airport by public transportation, go to work by public transportation, and the like. But I live in relatively urbanized areas of Greater New Haven, and not everybody has that luxury. Energy conservation. Air conditioning takes much more energy than fans. And sometimes it's a matter of raising consciousness, how a fan can be deployed, how a fan can be put in a window, create a window fan, all sorts of ability to reduce air conditioning utilization and increase fan utilization. My wife and I have been striving to do this in our own households just to teach ourselves how easy or difficult this is. And we have radically reduced the weeks that we are using our air conditioning in our home as a consequence. Automatic shutoffs. to ensure that lights are not utilized more than necessary, and the like. LED, LEED buildings, LEED buildings, efficient buildings. Sustainable energy sources, that's supposed to be solar, not AOLAR. Solar, wind, water, wave, we don't have down yet, but engineers are working on it. Entropy capture, you're using entropy capture when you have a hybrid vehicle. And sustainable land use and population stabilization. This includes vegetable-based diets, which is a way of reducing animal use of land, which is far less efficient than sustainable land use. 10 kilos of plant protein are needed for to equal 1 kilo of animal protein. So you can consume the plant protein directly and avoid this tremendous waste of plant protein that can be directly consumed just to generate a kilo of animal protein. Economic incentives, cap and trade, carbon credits, tax credits. I used to be hostile to these because I said to myself, you know, you're not actually reducing greenhouse gases, but I didn't really understand them as much. And I've learned from my Yale colleagues that, in fact, the whole principle is that when you have somewhat unavoidable greenhouse gas emission, at least you're neutralizing it by the replanting of forests, the renewal investments, and I've become less hostile, and some of you know more about this than I do, can comment at the discussion. And political change and commitment is essential. A moratorium on fossil fuel exploration with a massive shift to alternative energy sources would be a good thing, in my view. Commitment to conservation with policy shifts. Any of you who've spent time in Europe in the winter know that they keep their buildings colder than we do. And if you've been in Europe in the summer, you know they keep their buildings warmer than we do. And if we could go to 68 degrees Fahrenheit in the winter and 72 Fahrenheit in the summer, which are the centigrade equivalents, 20 and 22, we could save immense amount of energy in the United States. But I have to bring a stupid sweater to work in the summertime because I'm in one of Yale's older buildings, 1964. Well, it's not one of Yale's older buildings, but it's 1964 building, and it's the 15th least energy efficient building on campus out of 150 buildings. And it's a huge embarrassment to have the School of Public Health in this grossly energy inefficient building. We have been able to coax the university to make some investments, so we're making some improvements. But we would need a lot more investment to make it an energy efficient building than we have money to invest. So that's deeply disappointing to me. Now, keep in mind that tobacco use policies have been successful. We don't smoke in indoor buildings anymore. We don't smoke on airplanes anymore. Driving under the influence has been successful. You can do public policy and guidelines, and you can change how we act when we have systemic change and we have guidelines and regulations and we commit to these. It's just we've had more passion for indoor air quality and tobacco use and more passion to get drunk driving to a minimum than we've had for climate change, but we can make these changes. Keep in mind that there's preservation of wild places to enhance biodiversity and carbon dioxide mitigation. Rainforests and wild places help us reduce greenhouse gases, and many of you have contributed to such organizations for decades, as I have, in trying to preserve the wild spaces on Earth. I don't know what you think of the 26th UN Climate Change Conference of the Parties, as it's called. That's where the COP26 comes from, in Glasgow, which started on Halloween and ended 2 days ago on the 13th. So I don't know if you want to get into Halloween and the 13th, but it was inspiring on one hand, because we at least restored some of the commitment to the Paris Accords, and it was discouraging on the other because so much more could have been done. But let's hope that that is a turning point from the dark days of 3 or 4 years ago when we turned our back on the Paris Accords. Other elements of our response have to be sort of more micro. How do we mitigate the human harms and the human health harms of inevitable climate change? Because it's already on us. I mean, it's not a matter of preventing climate change. It's reducing the magnitude of climate change is really what the discussion is about. So we need a better emergency response and planning. We don't need a lot of dead elderly due to heat waves when we can plan for this and mitigate it. We're going to have to plan for droughts. We're going to have to plan for extreme weather. We're going to have to start relocating persons due to flooding or storms. We're going to have anticipatory relocating. There's a community of Native Alaskans that lives along the ocean near Nome, and the entire village is being relocated, something like 20, 30 kilometers inland, because the entire village is going to be inundated in the near future. This is going to cost millions of dollars, even for a small village. We need anticipatory work. Ocean barriers are very popular to discuss. Even New Haven now has a plan for a couple of $2 billion invested for ocean barriers, so that when the sea levels rise and the climate is unfriendly and there's storms, you're going to be able to raise giant barriers to protect the city from the ocean, Long Island Sound washing over large swaths of the city. You're aware of tens of billions of dollars being planned for the city of Miami and Miami Beach and Fort Lauderdale, et cetera. Billions and billions of dollars on mitigation. And some of the people voting for these ocean barriers are voting against climate change mitigation. So I am ambivalent about ocean barriers. I understand why we're investing in them, but I also can't believe that we don't believe in primary prevention rather than coping with it as if we can't do something about it up front. Air cooling, hydration planning for vulnerable populations we mentioned earlier, prior relocations I mentioned above, reforestation, not deforestation, vegetable-based diets emphasized rather than meat-based diets, control of air and water pollution for obvious reasons, and then we talked about vector control, water and hygiene innovation, the kind of irrigation that has been pioneered by such places as Israel, where the drip irrigation has made the deserts come alive without a lot of water waste. Of course, the Jordan River is now practically empty, with all that water having been diluted, so the populations downstream cannot derive the benefit of that water. Same thing we do with the Colorado. When it goes into Mexico, there isn't any more water. Making contraception available to meet unmet needs. All of these are mitigations that our school is working very hard on, the research, the policy, and the education. Now, political action. Greta Thunberg and students from around the world, the rolling blackouts in South Africa that got people's attention because it was weeks before the election. Here's Bishop's Orchards, for any of you who remember that venue in Guilford, Connecticut, where they've gone 100% solar energy. They have no net draw from the grid, and this is because they've converted some of their land in Guilford to solar farm, and divestment issues that Yale students are concerned about. Many of you are concerned about. We're doing a lot in the education space. We have a Yale School of Public Health online climate change and health certificate program. It's the first online certificate program that had ever been offered by a School of Public Health. It blends the convenience of working independently with some real time online interactions. It's 3 courses bundled into 8 weeks. We took a lead in developing one course. The CDC in Atlanta took a lead in developing the other. And then the third course was graduates of the Yale Center for Climate Communication who went to George Mason University in Northern Virginia, and they led that third one. We also have a mini master's being developed. We have a Coursera MOOC, which is, I think, free, if I'm not mistaken. You don't get the certificate, you don't get the interaction with faculty, but you can see all of the recorded lectures. A MOOC, for those of you who don't know, is a mass open online course. And then we have an executive master of public health that folks can now study climate change. And we have a number of K through 12 programs here in Connecticut and elsewhere. We also have a program on healthcare environmental sustainability. There are bound to be a few doctors and nurses and podiatrists and optometrists and mental health experts and social workers on this call. So keep in mind that if the healthcare industry globally were a country, it would be the 11th largest polluter country in the world. So one of the least energy efficient fields is in fact the healthcare field, where everything is use one and discard. I learned that of anesthetic gases, only about 3% are metabolized and 97% are re-excreted. Some of these gases are very potent greenhouse gases, and clever anesthesiologists like Jody Sherman, who leads this program here at our school and has her primary appointment in the School of Medicine. Jody is now recapturing these excreted anesthesia gases and disposing of them safely. And so this is a highly interdisciplinary collaboration. My last slide is just to refer you to our Yale Center for Climate Change and Health, our certificate program in climate change and health, and the next one is the Coursera MOOC, that's free. The program on climate change communication, to remind me to tell you this, all of this work is in close collaboration with the Yale School of the Environment and 2 climate change centers in that school, the Yale School of Law, where we work closely with a couple of the legal leaders in this field who are in the School of Law. We also work with the School of Management in this space and folks in Yale College and Faculty of Arts and Sciences. We even have worked with some of the art schools that are trying to pivot some of their energy to take a look at some of the issues in this area. And then the Yale program on climate, healthcare, environmental sustainability. So thank you very much for your attention. I hope I've been adequately provocative to stimulate some discussion. And I hope that you share my view that much can be done, much must be done. And I feel that this is not the time for despair. This is the time for action. I'm always bemused by my friends who say, well, if the wrong political party wins the election, I'm moving to Canada. And I remind them this is precisely the time not to move to Canada. This is precisely the time to redouble our efforts in our own country to do our part, because we are the highest utilization of energy, and we produce the most greenhouse gases of any country in the world, which is quite an extraordinary statement when you consider that our population is what, a quarter, a fifth of what the populations are of China and India, and yet we produce more greenhouse gases. So we can do a lot in our own backyard. Thank you.
Thank you, Dean Vermund. That was an incredible presentation, and I think absolutely quite provocative. We've already got a number of questions that have come in, all of them really profound and interesting. So thank you all for your questions. If you would like to ask a question and you haven't yet, please do post your question in the Q&A box, not in the chat, because it's hard to keep track of the questions that come in the chat. But please feel free to use the chat to talk to each other as you have been doing throughout Dean Vermund's presentation. There's a nice lively conversation going on in the chat. Thank you all for the comments that you posted there as well. I'm going to start Dean Vermund with a question about the certificate program. Tori says, I was in the first cohort group for the Yale School of Public Health certificate program in climate change and health, which was excellent. We learned that health is perhaps the best frame for climate communication, definitely much better than talking about the environment. Is the School of Public Health working on reframing the broader conversation? And if so, what have you been doing?
Rhoda Lee has a copy of 2 documents that I hope will get up on the website. One of them is the Connecticut effort that we've been doing around climate change and the report that we produced last year, which gives you a lot of the detail of activity in our own state to try to reframe this conversation, to try to bring health front and center, because as you imply, there will be many people who respond more viscerally to threats to the health of themselves and their families than to more theoretical threats to the environment. Now, it's kind of sad that that's the case, but we want to impress people on the importance of this, regardless of what message gets across. So the other is the 2021 Lancet Countdown on Climate Change and Health, which is a fairly substantial document, but it can give you a sense of the different areas in which the global community of public health and medicine, nursing, and the like are striving to get climate change into the mainstream of curricula, into the mainstream of research, into the mainstream of policy, and the mainstream of political action.
Okay, great. A number of questions coming in about the developed world versus the developing world. I want to start with Alice's question. She says, thank you for including human population as part of the climate change picture. And actually, in our series of 9 of these sessions, yours is the first to really address the population variable. So I think it's, it's a wonderful addition to the conversation. She says, your focus seemed to be on lesser developed countries due to high population growth and low access to family planning. Can you also speak to the intersection of population and consumption and the consequent climate change impacts? Because population growth in the US is projected to be lower, certainly, than in the developing world, but each new individual in the US will consume many, many, many times the resources as each new individual in the developing world. So our population and our consumption here in the US are a huge part of the climate change equation. And Alice says, let's not put this on slowing population growth in lesser developed countries.
This is an excellent point. When we have excess consumption, it may be that teak forests in northern Burma are feeding the Chinese furniture manufacturers who are then selling their furniture in the US. So there is a global chain of consumption in which you don't have to live in the teak forests of Burma, and you don't have to be chopping down the trees to be the originator of that tree being chopped down. So to say that excess population in low and middle income countries is the problem is not what I meant to say. And I appreciate your excellent addition to the argument, because everything that we consume that generates plastic or that's going to be using petroleum products, everything that we consume that comes from the natural environment may or may not be sustainably sourced. So this excess consumption, that's part of our economy, to be honest, and drives the global economy is a serious problem around the climate change agenda.
So I want to contrast that question with a couple of questions that have come in from Paul and Stephanie. And I've heard this from participants in some of our other sessions. We start talking about what we need to do at home to deal with our part of the climate change dynamic. And people always say, yeah, but what about China? So I'm going to go to Paul's question first. I think there's an argument to be made that some populations are more influential in drivers of climate change than others. For example, imagine that the entire population of Africa disappeared, about 1.3 billion people. How would that affect the worldwide rate of greenhouse gas production? It's still the case that if the US, China, India, Australia, and the EU continue at their current rates, we would essentially be on the same course for climate change. So continuing to sort of build on this idea of to what extent is it the developing world and population growth in the developing world versus consumption and greenhouse gas production in places like the US, China, India, Australia, and the EU.
The question answers itself. There is an overwhelming proportion of greenhouse gas emission coming from the venues just articulated. I don't have all the numbers memorized, but it could be 26% of global greenhouse gas emissions come from the US, and 20% come from China, and another 20% come from Europe. And these are the sorts of numbers we're talking about, so that you end up with probably 140 countries of the world that are producing less than 5% of the greenhouse gases. I don't want to trivialize the challenges in these countries, because many of these countries are being victimized by greenhouse gas emissions and global warming, even if they're not contributing disproportionately. So we're still going to need efforts to avoid desertification in the Sahel. And we're still going to need efforts to avoid deforestation in West Africa, in the Amazon rainforest, et cetera, in northern Burma. You may say, well, Burma is not contributing much to greenhouse gas emission, but Burma is disproportionately contributing to mitigating greenhouse gases because of the vast forests. And if we permit economic interests to deforest northern Burma, we've not done the globe as a whole any favors. So I feel like there is a complex matrix of conversations to be had. Why is Lake Chad being drained at the level that it is? And how might we mitigate that? Is it all due to drought, and only solution of the global circumstance is going to help? Or are there micro level interventions that can help the Chadians, the Nigerians, and the Nigerians who are feeding off of Lake Chad, that can help them keep their ecosystems alive and keep their ability to feed their families going? So I think there's action at every level, and I think if I were a Burundian activist, I would have plenty to do, and if I were a Nepali activist, I would have plenty to do. But at the end of the day, the questioner is, Paul and Stephanie are absolutely right. The overwhelming influence on damaging the planet is from the high consumption nations.
Okay, and just to follow on to that, Stephanie says, should the US and Europe not emphasize adaptation to protect public health, given the likelihood that neither the 1.5 or even 2 degrees centigrade goals are going to be achieved?
I've been using the word mitigation, and I probably should start evolving to the use of adaptation, because I know the literature is now using that term. But I meant adaptation when I was talking about mitigation. In other words, when we know that we're going to have more severe heat events, And we know that the vulnerable elderly, particularly the lower income vulnerable elderly, could die by the thousands in such an event. Then anticipating these events, ensuring that people might have fans to access when their air conditioner is not working, that we have emergency response repair technicians that already have mapped out where the vulnerable elderly are living, and maybe special hotlines, special neighbor to neighbor relations. I mean, there's so much that can be done for mitigation / adaptation. What I tried to say about flood plains and how we need to be planning ahead in that space. What we need to be planning ahead for severe weather events. We know that the least capacitated, the poorest housing quality, the stereotypic mobile home in Oklahoma or Alabama is far more vulnerable than the brick house. Reminds me of the old story of the three pigs and their different housing stock, and the wolf. So at the end of the day, there is so much to be done in the adaptation / mitigation space that we're going to have to do that in earnest if we're going to mitigate, reduce harms that are going to be inevitable with deteriorating global climate environments.
Okay, before we go to the next question, a couple of people asking for us to repeat the names of the two documents that you mentioned regarding reframing the climate change issue as a public health conversation rather than as a environmental issue. Tori is asking for the full name of the Lancet report that you referenced. And I think if you don't have them at the ready, that's fine. Just for Tori and Mark and people who are asking for links, we will post all of those links on the page where this conversation will live after the recording is done. So it usually takes a day or two for us to get it up. But for the recording, Dean Vermund's slides and links to the climate change certificate program, some of those we'll be able to get in the chat today. And if we don't, please check the Alumni Academy website, the Climate Change Conversations series page, and we will have all of these resources available to you on that page. A number of really good questions still coming in. I want to just continue, since we're talking about the developing world, continuing on that theme, a question about economic development. It seems from your presentation, economic development can be a real problem, but Stephanie points out that historically it has resulted in improved medical care and reduced birth rates and population pressures. Shouldn't economic development be a primary focus in Africa and other areas where in the developing world, even if some energy production to enable that development is required and results in CO2 release?
This is the principal argument of our colleagues in India, for example. They've been very articulate for many years as to the fact that they do not want to be left behind. They have hundreds of millions of people living in poverty, and they also have hundreds of millions of people who do not have even a modicum of adequate energy access. And for them to be left behind would simply be to enshrine global inequities, health inequities, economic inequities, educational inequities, and would be unfair. So I think we have to listen to these arguments and we have to respect them. One of the arguments that the Special Envoy for Climate Change in the Biden cabinet, Yale graduate John Kerry, would make if he were here, is that we can support sustainable technologies in nations that need energy. And one of the greatest assets in the tropics is solar power. The vastness of wasted energy because we do not capture energy from the sun cannot be overstated. So the notion of empowering impoverished Indians with fossil fuel energy rather than solar power energy is a fool's errand, and we should make the kinds of investments that we should be making more of in our own country, but we should help empower lower income nations in Africa, Asia, Latin America, who are blessed, if you will, with solar power, to exploit that power so that you can have your cake and eat it too, as the old phrase goes. You can expand economic opportunity, which requires energy, but you can do it with an emphasis on sustainable energy.
Okay. So really what we're talking about is we need innovation and technology to help develop those resources for people in places where solar power is a really strong, viable solution to their economic development. So yeah, really interesting point. I want to go to a totally different but relevant topic that's been raised by a number of people, asking about mental health and the degree to which global warming causes a lot of concern and anxiety. The wildfires in the western US, causing mental health, and people just wanting to know if you can speak more about the mental health issues relevant to climate change.
I have friends who have experienced profound exogenous depression because of their despair around where we're going and their concern about what their grandchildren are going to experience on planet Earth. So I do sympathize immensely with not only people who've lost their homes through wildfires, not only people who have lost their homes because their well has run dry and there is no alternative water source, people who are beginning to lose their livelihoods as farmers or grazers because of semi-permanent land use shifts. There's a vast pool of people who are threatened in their livelihoods, in their homes, and their well-being. Many of the climate change offenses are also massive contributors to pollution. And there are people with diseases that are exacerbated by pollution, be it water or air. And at the end of the day, we're beginning to see the death of our oceans and our lakes. There's just a profound sense of concern. And what I've been striving to do in my own teaching is here's the bad news, here's the good news. And the fact that we have solar panels that are a tiny fraction of the cost that they were 20 years ago and substantially more efficient than they were. And that you can now empower people to use solar energy and it be competitive with the same cost as fossil fuel energy, and quite plausibly cheaper in the near future. There's so much that can be done by us as individuals, and then we can be examples for people in our communities. Now, if you're in an apartment house, you can be an activist in your dynamic of your apartment house, your condo, whatever. If you own a home, you can, if you have just a little bit of favorable directionality, you can make your home solar. And the tax breaks are considerable, and the payoff of the whole system is typically in the 6-year range, where after 6 years, everything you invested, you're getting back in savings. And many of us are middle class or upper middle class. We can afford to make those investments. We don't do it because we have other priorities for our income and our savings. But I would just urge everybody on this call to consider this, because it's not simply what you can do in 100 homes. It's the influence that you have in your community as community leaders, as educated individuals in your towns, as Yale graduates. And I feel like there's so much that we can be doing as examples and as activists in our local environments. And I do believe that action is something that can stave off depression, because depression reinforces inaction. It's almost a disease in which the cure is being inhibited by the disease process itself. And I think that the more that we can band together in activism, the more we can stave off the so-called climate change depression that can loom large when one sees the grim realities of what we're up against. Now, we are going to have to cope with certain realities that we may be building homes in the wrong places. If we continue to build homes the way they do in the city of Houston, where they have virtually no limits on where to build homes, and homes are built routinely in floodplains, you can anticipate that Hurricane Harvey is going to be repeated over and over and over and over again. Building on the Ocracoke community of the Outer Banks of North Carolina, or Duck, North Carolina, or just places that should be pristine, and yet we continue to build homes on top of sand dunes with no sort of mitigation consideration of what's best for the ecology. And the same in nesting homes within forests. It may be very, very vulnerable to wildfires that are going to be increasingly frequent. Now, do I want to ban people from living by the ocean? Do I want to ban people from living in the forest? I don't think so. But the point is, we can do much better with urban and rural planning to mitigate future harms.
Well, and that goes right into Tom's point, who says many in big cities argue that large cities like New York or cities like London are inherently more efficient. Do you agree or disagree, and why?
Well, when I was in college, I studied a guy named Courvoisier. I think that was his name. A great French visionary architect. And a fundamental of Courvoisier's vision was the building vertically, and that one would have highly efficient vertical living and would preserve the natural environment as a consequence. Rather than suburban sprawl, one would have concentrated living environments. And Courvoisier dates back at least 50 years. And so these ideas have been around for a long, long time. Buckminster Fuller in the 1940s had designs that were along these lines. And I know these are still being studied to this day by Yale architecture students. So I do believe that we need to start thinking out of the box as to the most efficient ways to live. We have folks in our architecture school who are doing extraordinary work around sustainable architecture. And I believe that there's so much more that we can be doing to reduce our inefficient housing footprint, gain efficiency, and help restore forests, grasslands, wetlands, and reduce desertification. So at the end of the day, I think this is an example of the innovation that we in academia need to be doing more of, and that you as our alumni can help us. And many of you are in this field or an analogous field and will make your own contributions.
Okay, Gilbert wants to talk a bit about, we talked for a minute about cities, going to those rural communities in countries in the developing world. Could you comment on the role of plant-based agriculture substituting for animal-based agriculture where there is malnutrition?
Many of us read Diet for a Small Planet. I probably read it earlier than many of you because I'm 67 years old. And I stopped eating red meats in college as a consequence. I read the book and that was it. I realized that we could not sustain a meat-based environment, meat-based diet, and be maximally efficient. So if one can grow crops which do not have the severe impact of methane belching cows and cattle, and don't have the need to deforest as severely as grazing land sometimes does. There are just many advantages of farm-based environmental shifts. And we're so efficient in farming now that we need less farmland than ever to feed our populations, whether it's in the US or with the Green Revolution in India. So the notion that we are producing plant protein, consuming plant protein, it reduces obesity, it reduces blood pressure, it reduces cardiovascular risk. There are many cancers that are reduced with vegetables. There's a reason why the Loma Linda School of Public Health, which is affiliated with Seventh-day Adventist Church, has been doing large cohorts of nutritional studies. And there's a reason why vegetarians live longer than carnivores do in the human population. So at the end of the day, I think we can improve the efficiency of land use. We can improve human health if we can pivot to a more vegetable-based diet. And this has to be done with intelligent nutritional input. For example, the classic diet of rice with beans, that is the mainstay of so much of Latin America, for example, much of Asia, has synergies between the rice and the beans. And when you are crafting these vegetarian diets, often the historic memory of traditional diets are far more healthy. For example, one looks at vegetarian diets in India, they're remarkably balanced. And you have the rice and the dal, which is derived from beans. So at the end of the day, we have much wisdom in our traditional societies. And by the way, I want to thank all the people who are correcting all of my mistakes in the chat. That's very helpful.
I always enjoy seeing the chat in these conversations because people do bring such a wealth of knowledge and expertise to all the subjects that we discuss. And as I said earlier, it's important for you all to network with each other as well. I want to just flag that one of our climate change conversations in this series was with Gernot Laganda, who was the Director of Climate and Disaster Risk Reduction at the United Nations World Food Program. And he was a World Fellow with the Jackson Institute at Yale. And we discussed in that session, we discussed that topic in earnest in terms of changing agricultural processes in the developing world. So I encourage you, if you're interested in that topic, to visit our website and review that session. I want to go to Cornelia's question, and this has to do a little bit with the conversation we had last Thursday with your colleague, Paul Turner, who talked about virology and climate change. Cornelia asked, what do you think will happen with vector-borne diseases in the southeast? I'm assuming that's the southeast of the US in the next 20 years. And she said, especially mosquito-borne diseases.
The theory is that they will become more common if we maintain our public health infrastructures, because we are a high-income country. Then we can do a public health surveillance of mosquitoes and even of wild animals, so that we get an early warning sign that certain viruses are circulating. But do you know what we do when we get that early warning sign? Would anybody care to guess? At 3 in the morning, a pesticide fogging unit will be out in your neighborhoods, blowing pesticide into the air to have adult mosquito knockdowns. It's highly, highly environmentally inefficient, and sometimes highly environmentally harmful, because along with killing all of these mosquitoes, we are killing other insects, butterflies, and the like. So at the end of the day, the best approach is to reduce mosquito breeding, and that is far more labor intensive. It's cheap to put out a team of healthcare environmental workers to blow insecticide into the air to knock down mosquitoes because Eastern equine encephalitis virus is circulating, or West Nile virus is circulating, or even Zika virus might be circulating. And but it's so environmentally unfriendly that controlling mosquito breeding at the source is more efficient. Back in the 1960s, we had a major effort to reduce Aedes aegypti mosquito breeding in the southeast of the United States, because Aedes aegypti is the vector for yellow fever. It's the vector for dengue fever and others, Zika virus. And we were worried that dengue would come into the southeast of the United States, since it's highly endemic in the Caribbean. But it was a miserable failure, because breeding areas for Aedes aegypti are in small vessels. So the eaves of your house, the pots in your yard, the old tire that you haven't thrown away, the lip of the tire, that's where Aedes thrives. And people wouldn't open their houses. They said, I'm not letting this health worker look in my house. You have no business to snoop in my eaves, tell me my eaves are clogged, and insult me. And so it was a miserable failure, because we don't have quite the community spirit we would like to have. And so it's going to be tough to control expanding mosquito breeding and tick breeding through environmental control that's environmentally friendly. It's going to be cheap and simple to do it through environmentally unfriendly strategies. So this is going to be a major political and policy challenge for us.
Well, and I have, we've had a number of people come in with questions on public policy and politics, and I've steered the public health questions to you rather than those, but I think that it is an important aspect to consider in terms of the action that you can take in your own communities. And with that in mind, I want to give you the last word, Dean Vermund. We're coming up on the end of our session.
I want to refer everybody to the question and answers and to the chats. This is a very sophisticated audience, and there's immense wisdom. Everything from geothermal options. I have an uncle who did geothermal heating. Amazing efficiency of this technology. Some of you have heard about the School of the Environment and Engineering and Faculty of Arts and Sciences getting the FedEx gift for carbon capture research. And there are many comments about the politicization of the environment. I mean, it wasn't so long ago that a lot of the environmental activists were Republicans. And there still are environmental activists who are Republicans. But right now, it's been made into a sort of partisan area where you are assumed to be a Democrat if you want to protect the environment. The last that I checked, the word conservative was from the base conserve. And I've known my next door neighbors growing up in Madison, Wisconsin, were avid Republicans and avid environmentalists. And they were hunters, and they were very careful about gun safety, and they were very careful about only taking the deer that they were allowed to take because they understood the maintenance. I mean, there's nothing inherently partisan about the environment. So I would leave you with that note that we are going to have to talk across the aisle. We are going to have to seek allies who are from different political perspectives, and we're going to have to acknowledge various points of view. I thought the point about the development needs in low-income countries was a good one. If we simply try to take viewpoints that are going to inhibit people who are really being victimized by global climate change rather than people who need to benefit from clean energy, I think we're taking the wrong tack. So I want to thank you all for your attention. It's been a privilege to chat with you today. And I've actually just cut and pasted all of the chats and all of the Q&A because I want to study them later on and see what I can learn. And I'm sorry we only got to a fraction of the points, but it was a remarkable time, the last 90 minutes. I have put the link to the Connecticut climate change report, and someone else was kind enough to put a link to the Lancet report. So you have those, and we'll be putting those on the website in the near future.
Thank you, Dean Vermund. It's such a pleasure to have you. And few people may know that you are always a champion of alumni, always here to support the alumni community. So we're so grateful for your presentation today and that you have very neatly rounded out our climate change conversation series. I encourage all of you to visit our Yale Alumni Academy website to view those conversations that you may have missed. And I also thank our colleagues and our friends in the Harvard alumni travel community for joining us in this series. It's great to have two schools and the greatest minds at these schools here working on this topic. And we will see you again at next year's climate change converse series because this is an annual event. And hopefully we'll see you on another Yale Alumni Academy program soon. Thank you. Bye-bye, everyone.
Thanks, Lauren.